Welcome to Terra Firma Resources Pandemic Awareness Training. What is a pandemic? Pandemics happen when a disease affects more people than what would be expected. Pandemics are unpredictable. They can occur at any time and happen anywhere. They can be any disease, most often an influenza or flu-related pandemic, but any virus can cause a pandemic, such as a coronavirus. The three conditions necessary for a pandemic to occur are: a new virus has emerged. The virus makes humans very sick. The virus spreads easily from person to person. Viruses change constantly. Often this change is small, and since we've had the disease before, we have some immunity to this new virus. However, these small changes explain why we can get a seasonal flu each year. Sometimes though, a virus changes so radically that it's essentially a new virus. As a new virus, it usually causes serious illness in a large number of people, because we have little or no immunity to it. Is a flu pandemic likely? The human influenza type A virus changes a little bit every year. This change is normal. However, large changes do occur and can cause pandemics. This large shift is considered normal and usually happens 3 or 4 times a century. Influenza pandemics occurred in 1918, 1957, 1968, and 2009. In 2020, a pandemic was declared for the coronavirus. This virus causes the COVID-19 disease. COVID-19 presents symptoms more like a cold, but can include a fever. To help your understanding, seasonal or common influenza or flu is a respiratory illness that's transmitted from person to person. Most people have immunity because the virus is similar to viruses that we've been exposed to in the past. A vaccine is usually available. Swine and avian influenzas are viruses that occur naturally among animals or birds. In most cases, these viruses cause few health problems to humans. However, the virus can shift or mutate to one that can affect humans. Infectious organisms that jump from animals to humans are also known as zoonoses. Pandemic influenza, or flu, is a new human flu virus that causes a global outbreak of a serious illness. Immunity is the key to what creates a pandemic situation. Our immune system constantly protects us from diseases by making antibodies to stop invading antigens and other foreign bodies. A virus is an antigen, and our bodies create antibodies to fight the virus. It's normal for a virus to change a little every year. When the change in the virus is small, our existing antigens will still help protect us. However, when the virus has changed so much that it's considered to be a new virus, our existing antibodies don't protect us. The influenza virus continually changes from year to year. This change is known as antigenic drift. Why be prepared? Pandemic influenza situations have been studied. While much can change from situation to situation, what's known is that an influenza pandemic will not be like a normal flu. A pandemic may last up to 2 years and will occur in waves. These are best guesses based on the previous pandemics. Each wave could last 6 to 8 weeks and be separated by 3 to 9 months. High rates of illness and death are possible. In addition, because many people will be ill or away from work, these absences may have an impact on other areas. As seen in 2020, actions were taken by governments to slow the spread of the coronavirus, including requesting individuals to practice physical social distancing and self-isolation. Other steps included closing schools and allowing only essential businesses to remain open. It's still difficult to say exactly how ill people will become. In 1918, the virus affected healthy adults between the ages of 20 and 40. This change was very different, as a seasonal flu virus typically affects the very young, very old, and those with weakened immune systems. With the COVID-19 disease, while people of all ages have become ill, there is an increased risk of more severe outcomes for Canadians that are aged 65 and over, have compromised immune systems, and have underlying medical conditions. Physical social distancing means making changes in your everyday routines in order to minimize close contact with others, including avoiding crowded places and non-essential gatherings, avoiding common greetings, such as handshakes, limiting contact with people at high risk, such as older adults and those in poor health, and keeping a distance of at least 2 arms lengths, or approximately 2 meters, from others, as much as possible. Self-isolation means that, for 14 days, you need to stay at home and monitor yourself for symptoms, even if mild. Avoid contact with other people to help prevent transmission of the virus at the earliest stage of illness. And do your part to prevent the spread of disease in your home and in your community, in case you develop symptoms. Let's briefly review the flu, the virus, and how it affects us. Signs and symptoms of a flu generally include fever, sore throat, cough with no mucus at the beginning, chills, and muscle aches. For adults, the incubation period is from 1 to 4 days, with symptoms usually showing after 2 days. Symptoms last 2 to 5 days, but people can be infected without showing any signs, known as being asymptomatic. As stated by Health Canada, those who are infected with COVID-19 may have little to no symptoms. You may not know you have symptoms of COVID-19 because they are similar to a cold or flu. Symptoms may take up to 14 days to appear after exposure to COVID-19. This is the longest known incubation period for this disease. We are currently investigating if the virus can be transmitted to others if someone is not showing symptoms. While experts believe that it is possible, it is considered less common. Symptoms have included fever, cough, difficulty breathing, and pneumonia in both lungs. In severe cases, infection can lead to death. Perform a self-assessment. Are you experiencing any of the following? Severe difficulty breathing, such as struggling for each breath or speaking in single words. Severe chest pain. Having a very hard time waking up. Feeling confused, or lost consciousness. If you answer yes to any of the above, please call 911 or go directly to your nearest emergency department. Are you experiencing any of the following? Shortness of breath at rest, inability to lie down because of difficulty breathing, or chronic health conditions that you are having difficulty managing because of your current respiratory illness? If you answer yes to any of the above, you may need to speak with a nurse about your symptoms. Please call 811. In the past 10 days, have you experienced any of the following? Fever, new onset of cough or worsening of chronic cough, new or worsening shortness of breath, new or worsening difficulty breathing, sore throat, or runny nose? If you answer yes to any of the above, you must immediately self-isolate. You are recommended to be tested for COVID-19. Do you have any of the following? Chills, painful swallowing, stuffy nose, headache, muscle or joint ache, feeling unwell, fatigue or severe exhaustion, nausea, vomiting, diarrhea or unexplained loss of appetite, loss of sense of smell or taste, or conjunctivitis, also known as pink eye? In the past 14 days, did you return from travel outside of Canada, or did you have close contact with someone who's confirmed as having COVID-19? If you answer yes, you must immediately self-isolate. You are recommended to be tested for COVID-19. As of March 25th, Albertans are legally required under public health order to self-isolate for 14 days after returning from travel outside of Canada, or from the date of close contact with someone who is confirmed as having COVID-19. Are you experiencing any of the following? Shortness of breath at rest, inability to lie down because of difficulty breathing, or chronic health conditions that you are having difficulty managing because of your current respiratory illness? If you answer yes to any of the above, you may need to speak with a nurse about your symptoms. Please call 811. With more people sick and with higher absences, we can expect the following impacts. People may choose to stay at home. Others may choose to stay at home to care for sick family members. Employees may be trained for and assigned different or additional duties. Or, job duties that would normally be done in person may be done by telephone or via the internet. Service disruptions due to lack of staff. This may include banking, groceries and supplies, municipal and government services, and more. Closure of schools and other businesses that involve social gatherings. And closure of non-essential businesses. Business continuity plan. While there are still many questions about what will happen in a pandemic, you can and should be prepared. The impacts of a serious pandemic will be more manageable if organizations have a business continuity plan. A business continuity plan describes how the organization will function during emergencies. This plan should include what steps to take, how employees will be prepared or trained, and up-to-date sick leave policies. Business continuity plans will be unique for each organization. They may be expanded to cover a range of situations, even beyond a pandemic. The focus is on how the business will continue to operate in the event of no services such as telecommunications, electricity, water, or transportation networks, and reduced number of staff. Key ways to help slow the spread of a virus include washing your hands more often with water and soap. Use alcohol-based hand sanitizer if water and soap aren't available. Using tissues and throwing them away right away. If you don't have a tissue, coughing or sneezing into your elbow or sleeve. If you cough into your hands, then shake hands or touch surfaces, the virus has spread. Staying home if you are sick or think you might be. Washing your hands after touching hand railings, door handles, ATM machines, public telephones, and more. Not touching your eyes or face with your hands. The virus can easily enter the body through your eyes, nose, and mouth. Cleaning surfaces such as doorknobs and railings regularly. And practicing physical social distancing, keeping a distance between yourself and other people. Hand washing. Yes, hand washing sounds basic, but it is one of the most effective ways to reduce the spread of viruses. Be sure to scrub properly. Take 20 seconds or sing happy birthday or ABCD twice to time yourself, and really lather up, getting in between fingers and under your nails. Use a paper towel to dry your hands and then use the towel to turn off the water, otherwise you are touching a dirty tap with your clean hands. Keep the towel and use it to open the door. Have a garbage container right beside the door to drop the towel in after the door is open. Alcohol-based hand sanitizers are an easy way to wash your hands when you don't have easy access to soap and water. Hand sanitizers work best when your hands are clean and have no visible dirt. If your hands are dirty, use soap and water. Some of these products are made of ethyl alcohol mixed with emollients or skin softeners and other agents. They're often available as a gel or on wipes or towelettes. Alcohol-based hand sanitizers should contain at least 60% alcohol. Sanitizers don't eliminate all types of germs and might not remove some chemicals. Hand sanitizers may have odors which may be irritating to some users. Apply suggested amount to the palm of one hand based on the manufacturer's recommendations. Rub hands together. Spread and rub the product over your hands and fingers until your hands are dry. Use enough product to cover all of your hands and fingers. Be ready at home. In general, Public Safety Canada encourages all Canadian families to be prepared for the first 72 hours of any emergency. A family emergency plan will help in a pandemic, just as it will for severe storms, floods, wildfires, or power outages. Have an emergency kit with supplies for your family and pets. Make a list of emergency contacts. Know your family's health information and needs. And stock your medicine cabinet with supplies for flu, as well as prescriptions. By following these guidelines, we can stay healthy and happy both at home and at work. Thank you for participating in Terra Firma's pandemic awareness training.